Good afternoon and welcome to today's webinar. I'm Lindsay Scott and I'm a Sales Director with SRS. Today we're going to talk to Terry Wiederhafe at Orthopaedic Associates of Wausau regarding their experience with EHR. I'd like to introduce to you Terry Wiederhafe, the clinic administrator for Orthopaedic Associates of Wausau. So welcome, Terry, and thanks for joining us today. And Terry, would you mind giving us an overview about Orthopaedic Associates of Wausau?
Not a problem. It's great to be here with you today. I've been with Orthopaedic Associates since they started 12 years ago, so it's been a real interesting ride to kind of assist them in building their practice. We started out in 2001 with 3 providers. We are now at 7 providers with 1 extender. We're an ortho specialty office in central Wisconsin. We have general orthopedic surgeons. We also have hand specialists, and we recently added a trauma specialist to the group as well.
Wonderful. So getting started regarding your EHR experience, can you give us a little background on how long you were using your prior system? I know that there were 2 other EHRs that you were with before SRS, so can you just give us a background on your experience with those?
Not a problem. I'm really fortunate to work with some progressive doctors who are not intimidated by technology. So when electronic records were first being talked about, we started discussing it within the office right away. Our first EHR was installed in 2004. It was one of the original ones, and it was completely template-driven. It was a traditional EMR that was really designed for a general practice. We found that there was some ortho content in it, but it was not the kind of content that a specialist would use. It was something that a family practitioner might use when they saw a patient with a knee problem or a hip problem. We did have the ability to design our own templates so that we could put them in ourselves. So we built a number of templates, but every time we tried to add a template that had extensive information included in it, the system blew up and went down. So we had a lot of downtime with the system. It was just not very user-friendly. The vendor suggested that when we go live with all the doctors at once. So at this point, we were 3 doctors. So we all went live. We were told to cut our clinic patient volume in half. To prep for clinic, it was very time-consuming for the staff. They had to add all the medical information themselves. They had to type everything in. There wasn't a list of all the medications available, to add previous tests, previous procedures, so it was very labor-intensive before the patient even got here. We were struggling to keep up even with half of the patient load. It was cumbersome. It was difficult to use. The templates were not user-friendly. We found that we could not stay efficient. We were falling behind, and we didn't want our patients suffering because of that. The doctors did not like the look of the patient record. It was template-driven, therefore the office note came out with this canned look, and there was nothing that we could do to change that. After a year of frustration and trying to work with the vendor to improve the downtime, to improve the templates, to make things more efficient, they finally agreed that this really wasn't something that was designed for a specialist office, and we probably would be happier with a different product. So we spent a year looking, researching, analyzing, trying to find something that was specialty specific. In 2006, we installed our second electronic record. We found that many of those frustrations stayed the same, but this time we insisted on going live with 1 doctor at a time. And of course, we started with our champion doctors, so we were very enthused about this. Clinics still had to be reduced by half, and we had a very hard time ever getting back to a regular clinic day. Prep of the chart for the patient arrival was just as difficult as it had been before. In this instance, we were not allowed to make templates. They said they were all in there, all the information was there. And it probably was, but finding it was a real challenge. We also had that same look of the canned report that the doctors didn't like. So doctors were frustrated, staff was frustrated, clinics were reduced. It was difficult to get us back to a normal patient load, and if we did get us back to a patient load that was comfortable, Then the doctors were up all night documenting in the system. We had been working with the vendor trying to make this more efficient, and they suggested that we visit a clinic where it was working very effectively. So they sent one of our docs over to the clinic. The advice was that every doctor needed to hire a scribe that followed them, and the scribe would do the documenting for the doctor so that they wouldn't have to worry about it. And they also told us that we needed to realize that we would never be efficient documenting on an EMR compared to a doctor dictating. So here we are, we have gone through 2 EMRs, hoping to go paperless. We still have paper charts because the doctors found the systems too cumbersome to even go in and get information. So every time they templated, we would print off the document and put it in the paper chart. After 2 years of this system, we just decided we were going to call it quits, take a step back, and analyze what we really needed to make this office efficient.
Thanks, Terry. Let me ask you, what do you think really was the tipping point, or, was it the loss of productivity, or what would you say was the tipping point in moving forward to look for a third EHR?
There were a lot of things. It was the loss of productivity. We wanted to remain as efficient as we had before, and we couldn't understand that if we were using technology, why it was slowing us down so much. The doctors still wanted to have the look and feel of their chart notes. They didn't like the canned notes, and the options that we were given from the 2 previous vendors just did not give them the option that they were looking for. And yes, they could dictate parts of it, or they could use Dragon and do that, and we did try and do that. And some doctors even started typing in information themselves. It still didn't give us what we wanted. And with the chart notes, the final straw for us was when we were trying to defend these if we were deposed. It was just not the same as having the detail in the chart notes that the doctors were used to. After about a year, we decided that we were going to go through a selection process and look at some new vendors. I had a demo of SRS years ago and was impressed with it at the time. It looked like it was easy to use. It looked like it was a great way to go paperless, not only with charts, but also in the business office as well. And the most important thing to us was that the physician's notes could look the way they wanted them to look. It was an efficient system, and it was user-friendly. The only drawback that we had at the time was that SRS was not certified for meaningful use. I had met a number of the reps, and I'd been keeping in touch with them. And I said, as soon as you become certified, give me a call, and then we'll talk. So that's how this all came about. Once SRS became certified for meaningful use, I knew it was time to present it to the practice. Once the staff and the physicians saw the product and SRS's approach to an electronic record, we were all in agreement that this really was the EMR that we knew it would work for us. In 2001, with the electronic records requirements, we knew we needed a system to help us meet those requirements. So that was the time that we decided to install the system. We went live only with the medication module first. It was about 4 months later that we added the rest of the clinic module. And by the time we went live with the whole product, we were paperless. An implementation specialist was assigned to us, and I had a number of conversations with her before going live with anything. By the time we turned on the system, the staff was familiar with the screens, the processes, the whole thing, so there wasn't a lot of staff being scared of using the system. Once we had ERX portion turned on, and we're using that, and we're comfortable with that, then we started preparing for the big go-live, when we were going to add all of the other modules. We continued to have weekly meetings with the implementation specialist. She would give us our training and our assignments over the phone or through webinars. Then we had a week to set up that portion of the system. So the staff continued to work on the system. They continued to become familiar with the screens and the processes. And this went on for about 3 months before the big go-live. We also decided to incorporate our forms into SRS. We went through all of the paper forms that we use in our office, as well as the forms that some of the local facilities where we provide services use. And we were able to take those forms and actually have them developed in SRS so that they're available online. If we're ordering a procedure at the surgery center, all we have to do is pull up their order form, complete it, and we've got it set up so that SRS is pulling in all of the pertinent patient information. We just fill in the basics, and we can fax it along with the patient records right to the surgery center. It's the same thing with our PT forms, our return to work forms. All of those things are built online, so it's really efficient. We don't have those situations of we lost a form, it's not in the chart, where is it? This is the third copy, I can't read it anymore. So all of those issues have gone away. We also built our encounter form, our patient route slip in the system. When the doctor finishes seeing the patient, he pulls up the encounter form online, he indicates what he's done, and at the end of his clinic day, that clinic batch gets forwarded over to the business office so that they can go ahead and process it. And we do the same thing with our pre-certification. Whenever we order a test or a procedure, a copy of that order is forwarded to the business office so that we can take care of the pre-certification right away and not miss anything. Our implementation specialist was here when we went live. We did not have to reduce our patient load. Staff and physicians were familiar with the software. There was no anxiety about the change at this point. Our patients were not even aware that we were transitioning to a new system. We set up our on-live chart so that it looked just like the paper chart with the same tabs and all the same information in it. So anyone in the office could go online onto SRS and go through the chart and be familiar with it because it looked just like the regular patient chart that we had when we were on paper. We did hire some college students to come in evenings and on weekends to do scanning for us. When we went live, we scanned in the immediate appointments, so the entire chart would be scanned in, and once those were caught up, then we started scanning in the backlog of all of the other charts. And it's been almost 2 years, and we are just about finished with scanning in all of that information. So that's been our experience with the transition and why we transitioned, and actually how well it went for us. I was very pleased. It was the easiest implementation of any EMR that I had worked with.
Wonderful. So since you've implemented SRS and replaced your previous EHRs, how has your partnership experience been with the company?
SRS has been great to work with. I can't say enough about the implementation specialists and the account reps that I've had to work with. They're very dedicated to their customers, and they're there to assist you with anything that you need. Customer support has been very easy to work with. I usually will go online and do a support request when I need something. There's also information online, so when you're putting in a request for support, you can search to see if the situation is out there, to see if you can address it yourself without sending it. If I actually have to submit something, I usually get a phone call from someone in support, usually within an hour. If it's something that needs to be done immediately, of course it is done right away. Though I can't think of a situation where it's taken more than a day to get my answers addressed or the situation taken care of. We recently decided to add a new form. So I kind of warned the clinical staff, it's a form. It might take a couple of weeks for them to get it on their schedule, get it built, get everything taken care of, and get it back so that we can test it and see if it works. We actually had it back within just a couple of days, and it worked perfectly.
Wonderful. Can you also speak to, I know that you're attesting for the Meaningful Use program. Can you speak to your experience and how that's gone for you?
Meaningful Use is so much fun. It really can be a daunting project. SRS made it very methodical. They were very helpful in helping us understand what needed to be done and how we needed to do it with the software. They had webinars, They have online training. There is a lot of information on the website. The annual meeting that I attended, there was a lot of information. So I felt like I had enough to be comfortable with to go ahead and start this process. So we got everything set up. Everything was set. The physicians knew what their requirements were. The staff understood it. Went through our whole 90-day attestation, of course, checking the reports and everything along the way. Once I had actually run the reports at the end of the first 90 days, I wanted to make sure I fully understood them and understood where all the fields were pulling information from, how it was going to be when I went to a test online. So I called support, and someone called me back within an hour and actually worked with me, looked at the reports, went through them all, showed me where the information was coming from, how it was being pulled, how it would be used when I went to a test. Once I actually went online to a test, I was breezing through, and it was very, very easy because SRS has put together so much documentation to assist their clients with this. But I did end up having a couple of questions, so I called my account rep. Well, this was one of the days when there was a huge snowstorm out in New York and New Jersey, and SRS was closing up their offices early so staff could actually get home before the worst of it hit. And I was really impressed. He was so familiar with the screens that he could actually talk to me from his office at home and explain to me exactly what was going on, what I needed to do, this is what this question meant or that, even though because of the storm he couldn't even get into his system at that time. So the attestation was very easy and very efficient. I was really pleased.
Great. You know, I know that one of the concerns that some practices have when they're looking at implementing an EHR is the, interface capabilities, and a lot of practices worry that there'll be finger pointing if there's issues between interfaces. Can you speak to your experience? I know that you have the GE Centricity Practice Management System. Can you speak to your experience with how that interface has gone?
Oh, sure, Lindsay, and I agree with you. Interfaces can be very intimidating. I interfaced all 3 of the EMRs that we used with GE Centricity. As long as you are thinking ahead, what kind of fields do you want to bring across, what kind of information is important to you, and you're working with your vendors on that, it can be a very smooth process. And quite honestly, in all 3 of my situations, that was very smooth. And that was not an issue that ever came up with the records that we did. SRS is very willing to work with other vendors, as they would be. You're really an EHR vendor. You need to be able to work with the various practice management systems that are out there, and I think that you do that very well. GE Centricity is also very supportive of whatever their clients want. So they understood that their EMR solution was not the one for our office, so they were going to do whatever they could to make sure that the total solution we had, Centricity plus SRS, was going to work. So GE, SRS, and I sat down and we went through all of the various fields that we wanted coming across and why we wanted them to come across and how we wanted it to happen. Once they understood what I was looking for, then GE and SRS actually took the ball and went with it and built the interface and put everything together. Once we turned it on, it was seamless. It worked perfectly. There were no issues. At one point, we did update our practice management system, and some fields changed, and we found that some things were not coming over, some things were sporadic. So I called SRS and GE and let them know that we were having a problem with the interface at this point. The 2 of them worked together well. Within 24 hours, our interface was working seamlessly again. So they worked very, very well together.
Thanks. Now, I know that you had mentioned that one of the major problems that you had with the first 2 EHRs was maintaining your productivity level, that you had to cut your patient load by 50%, and then you had to work to get up to the point where you were before. Can you speak to the productivity levels that you've experienced with SRS?
Oh, sure, and this was really important to us. The doctors insisted that they were not going to reduce patient loads anymore. It was not the answer for them. SRS was great. Like I said, when we went live, our patients didn't even realize that we had transitioned to another electronic record. we did not reduce our patient load. And because of the great implementation work that had gone in before, staff and physicians were familiar with the screens, they were familiar with the processes, so that everything went very smoothly. So we did not reduce the workload, and I have seen that our numbers are increasing in our patient counts in our clinics. So we've become more efficient in what we're doing, and we're increasing the patients that we're seeing at this point. We also, as most offices do, get volumes of calls coming in from patients. With the messaging portion of SRS, it keeps our triage department efficient. We can handle that workload with no problem. There's no issue trying to locate charts anymore because everything is all online and accessible to everybody. So that's been very helpful as well.
Great. Can you also speak to the overall satisfaction levels that your doctors and staff have experienced at the practice?
You can imagine, after the last 2 EMRs that we had and with the failures that we had with them, when we started talking EMR again, there was no cheering going on in this office. I really asked the doctors and the staff to keep an open mind. We had to do this. With ERX, with meaningful use, we don't have a choice. This is the way that we have to go. But now we're going to focus on efficiency. We're going to focus on making sure that we can continue to run our clinics the way the doctors want to run their clinics. They can see patients the way they want to see them, not the way an EMR is telling them they need to see them. It was something that everybody could be comfortable with. I didn't want to hear from another doctor that they didn't want to log into the EMR because they couldn't find the information anyway. The documentation was the biggest thing. They have what they want. They have their dictated record. It's not what a vendor says that they need to have. We have been on the system for 2 years. I have had no doctor or staff member come to me and tell me that they have regretted the decision to transition to SRS. It truly has been successful in our office.
Wonderful. Well, thanks again, Terry. That's some great information. With that, if you don't mind, I'd like to open it up for any questions that the audience may have for myself or for Terry. Here we go, Terry. One of the questions that has been put in is, what about the data conversion? Can you speak to, since you were on 2 previous EHRs, did you choose to do a data conversion from those EHRs, and just talk a little bit about that thought process?
Sure. Because of the way that we used the 2 previous EMRs, we did not do a data conversion. When we were using the other EMRs, because the doctors found the system so cumbersome and difficult to use, they would not go into the system to look up their previous notes. So we actually had to print them out and put them in a paper chart. So we had all of our paper charts, and we had all of that documentation from the system already in the paper chart. So we just felt it was easier, rather than trying to do a true data conversion, just to take those records that were already in the chart and scan them in as part of the chart in SRS once we started going live with SRS. So we didn't do a true data conversion, but this is something that worked for us.
Okay. Well, with that, I think we'll go ahead and move along here. One of the things I wanted to mention here about, SRS is SRS has the largest national orthopedic network in the industry, which is important not only because our software is going to be driven to meet the needs of your practice, but also because the most prestigious groups in the country have chosen SRS as their healthcare IT partner to take them into the future. So many of the groups that you see here now are actually utilizing our Continuity of Care Exchange platform, or CCX platform, to exchange discrete clinical data for outcomes reporting, which allows them to see improvements for patient care and increase practice revenue by earning quality-based incentive payments. So this CCX platform gives our customers the comfort of knowing that SRS is already well positioned to meet the interoperability requirements for stage 2 of meaningful use and beyond. I'm sure looking through some of these logos, you may recognize and know some of the administrators, or some of your physicians may have trained with some of the physicians at these practices. So although this is just a sample, you can visit our website that has a much larger listing with some testimonials about their experience and how their experience has been with SRS. As you can see here, although Illinois Bone & Joint is our largest customer, we also have one doctor practices and pretty much everywhere in between, which just shows the scalability of the product. So since today's webinar was focused on Orthopaedic Associates of Wausau and their experience, I highly recommend, if you haven't seen the productivity enhancing features in SRS, we'll put you in contact with the sales director in your territory, and we'd be happy to show you an in-depth product demonstration. So with that, we're going to finish with the webinar. You can see the contact information here for SRS, as well as the contact information for Terry if you'd like to reach out to her, either of us. So with that, thanks for joining us, and thanks, Terry, for sharing this information, and have a great day.